in basic composite labs, MBBS qualification is sufficient. But I have seen so many labs in India, in even in Vizag, the technician they will sign and they will give and issue the reports. And that is about the microbiology, biochemistry and pathology. Here this is important, radiological diagnosis. This is a little bit different. All these things, these type of techniques and these instruments, they have to register the license from AERB, Atomic Energy Regulatory Board of India, including, but ultrasonography and MRI need not the AERB, but nowadays recently they have added this CDSCO, but USG and MRI also added in PCP and GT. These are the, you know that PNDT, most of the forensic people, they know about the PNDT rules regarding how to use this USG and what are the, how to take the license, and the person who registered in the PNDT, he has to do the ultrasonography test, and we should not change the other person, we should not add the other person without intimating to the higher, that is this one. And also, all records regarding the how much, up to which time we have to keep our records. Actually, this 2 years rule is also gone. We have to keep the records in the electronic form till the end of that particular person. That means not in hospital, even for lifetime, that means. And there are some of the errors I like to show of radiological investigations, how they usually, these are errors usually can occur in observer errors, interpretation errors, and also failure to communicate in a timely, clinically approved manner. There's a lot of meaning for that one. That will take much more time for that. The other observer errors, these are scanning errors, recognition errors, and decision-making errors, and satisfaction of such errors, SOS errors, that is called intentional under-reading and collegial pressure. Because collegial pressure means from the colleagues or from the superiors. And this is one of the example for that one, scanning error and also observer error. They have taken three, this is CT, this is CT, and in three slices, three consecutive slices. In the middle slice, actually this particular, they're showing a small appearance area where the radiologist was mistaken for this. This is a simple conversion of the brain. And the patient was, he went to the, on the third day, again he got some problem. And again they have repeated these things. And when they saw that, you can see that there, the same thing, the hypotenuse area which the radiologist felt that this is a simple conversion. This is the one of the, because in the taking the cut, this is called actually CT cut. In the CT cut, they completely missed it. Again, I will show you this one, and this particular thing, there, and the right arrowhead, white arrowhead, that is, it's not a conversion. It is definitely, but radiologist missed. On the third day, again they have taken, and this particular simple thing is taken to hemorrhage. And that is one of the scanning error and also observer error. And this one, in the morning, Pujari sir showed me something, which is some scissors and everything. Here, what is the underreading and SOS error? SOS error means actually, the radiologist usually they will take whatever necessary. The other things he will leave. This is the case, actually laparotomy case, where after the laparotomy, for usual routine checkup of this lungs and heart, they have taken X-ray. But well, he has given that everything is fine. Because he has seen only lungs and heart only. Because it is due to that's called SOS error. He won't bother, usually the radiologist, he won't bother about the other thing. What is there? What is there in the abdomen? There is something is there, that is called, that is on the evening, on the same day evening, the patient got severe, again some problem, and they opened and they retrieved one retractor, that is a retractor there. But actually this chest X-ray impression is normal. That is, it is underreading and also SOS error. And here you can see, this is one of the technical errors in examination errors. What is this? Actually, this is CT of the splenic injury. Usually there some of the in cities there will be contrast agents. The flow of the contrast agents in this type of splenic injuries, the flow should be very high, up to 4 to 6 ml per second. But actually in the first, the upper two, the contrast is not entered, actually not absorbed by this one because of the slow flow rate. And in the second lower, and the lower left and lower right, you can see some pseudoaneurysms in the spleen. These aneurysms are high flow rate of these contrast agents. Actually, there is no difference whether it is a, definitely they can know based on the other findings that this is a splenic injury. But what happens if it is like this? If the pseudoaneurysms are found, or vascular injuries are found in this one, and the entire treatment procedure and entire outcome of the patient will be completely different because of these two. If vascular injury is present in the spleen, the management and outcome of the patient will be completely changed. This is one of the errors of observer and scanning errors. And you can see this. This is one of the errors in scanning errors. You can see in the lateral view of the elbow, nothing can be seen except there is a small halo, black color halo that is called pat sign. That is pat sign. This occurs in the elbow and anteriorly or posteriorly. With this, this is first X-ray was taken in somewhere, and the second X-ray was taken somewhere. In the first X-ray, the report was normal, and the next X-ray, when the angle of the X-ray was changed, simply you can find that this. Okay. This is some of the types of errors. And perceptual errors, and there are so many, this is completely cognizable errors. There are reasons for this one. Even some of the radiologists, they won't attend the phone calls while doing the examination of the CT or this one. This is one of the best procedures they will adopt because of a simple distraction can lead to SOS or underreading. And this is one of the, this is one case where a foreign body, there is no foreign body at all in this X-ray, but it is in the patient. That may be the popcorn in a small boy. Both the X-rays they had taken in inspiration and expiration. One of the radiologists they have given that this is normal. But if you see the second expression state, this particular thing, and this complete shift of the mediastinum onto the right side, that indicates air traffic, valve mechanism, and we can. This is one of the types of errors, and this is a case which is filed in Madras High Court. This is from Madras only. And interpretations. There are other things that the contrast errors and frequent telephone disturbances. I already told you about this one. And nobody needs the perfection in this one. A standard of average, competent skill is sufficient. And also, this is one of the important things. If a radiologist or any other one of the finds that this particular test which is written by or requested by the surgeon or any other specialist is not sufficient. If you want to go to other tests, the radiologist has to inform the same thing to the clinical doctor. If fail to do that, it's also it's an error. And why this has to do that? He is the only person who knows what are the findings inside the particular film. Because he is a specialist that one. There are also some cases were recorded and they sued the radiologist regarding this issue. And the first photograph I have shown you that. The other thing, actually this is not related to the patient, but something happened in MRI scan rooms. Actually, this is the safety of the MRI. This is, you can see there are so many objects which we can't take inside the MRI room. There are so many things, including watches, buttons, and bullets. We should not do MRI for a patient who involved in this one. And these are some of the medical devices. Usually we have to be very careful. But nowadays, they are completely, there are three types of things are there: MR safe, and MR conditional, and MR unsafe. Even including stents nowadays they are using, and also these pacemakers also they are MR safe. 5 minutes, sir. 5 minutes. I will finish this 5 minutes. And in the MR room, that means these are the complete it must be shielded with the ARP shield. It may be galvanized steel or copper, and this one. And regarding this is the particular conductive loops is related with the patient. The patient should be in a position that no other part of the body should touch with the body of the same patient. This means crossing the legs, or crossing they are touching the skin to skin, body to any thigh to abdomen, like that. You should be in a certain position because of these conductive loops or any wires can create the much heat inside the body, on the surface of the body. And even skin staples, metal clips also should be, we can't remove, but we have to take some ice packs, and should be ready to, if you find any temperature, any increase in the temperature there, we have to change it, and we have to remove the patient from that one. And this is the one of the that case, and these are the precautions how they have to take in MRIs. And this is the ACR.